Hello, my name is Mark Dovgaluk, and I am a university student studying classical voice, and I also lift weights. And today we're going to be talking about weightlifting for singers. First, I'll introduce you to the anatomical structures of the larynx, the parts of the body that we'll be talking about today. Then I'll introduce you to weightlifting generally as it relates to singers, what current research exists, and the potential benefits that weightlifting may have. And then we'll talk about common weightlifting practices that may be putting your voice at risk. To that, I will introduce some alternative breathing methods to the Valsalva Maneuver that are effective but ensure that singers are protecting their voice while performing them. And finally, I'll share some tips and tricks for a singer who might be interested in weightlifting and just some other general information that I picked up along the way of creating this video. Before I start, I'd like to preface that weightlifting as it relates to vocal health has not been researched extensively, and ultimately you should listen to your own body and do the kind of exercise that you feel is best for you and your own voice. With that said, let's get into some anatomy. A quick note, I realize that I go through this next section pretty fast, so if you're having trouble understanding me, feel free to slow down the video playback speed, and also I'll re-emphasize and bring up the most important points multiple times, so don't worry about not catching everything. Anyways, let's get into it for real this time. First, let's take a look at the anatomical structures we'll be talking about today. So this is a model of someone's skeleton cut in half, essentially. So this is your nose right here with the nasal cavity behind. This is your mouth. This whole structure here is your tongue. And this whole area is what we call the larynx, including everything you see in this region. This slit that you see right here is where the vocal cords are located. For orientation purposes, the larynx sits in the middle of the neck, right behind the Adam's apple. And the larynx has plenty of cartilage for protection. To demonstrate the various levels of cartilage, this is a deconstructed figure of the larynx. There are 3 unpaired midline cartilages, the epiglottis, thyroid, and cricoid cartilages. And there are 4 paired cartilages, the arytenoids, corniculates, cuneiforms, and the tritocele, which is located within the thyroid membrane. A quick fun fact, not everyone has this cartilage. A 2017 study found the tritocele cartilage present in only 33% of the population. Now, back to the basic anatomy. The trachea, also known as the windpipe, is right below the vocal cords, and the esophagus or food pipe sits right behind the trachea. Now, let's look above the vocal cords. So right above the vocal cords is the epiglottis, and the epiglottis connects the tongue to the front of the vocal cords. When you swallow, the epiglottis covers the vocal cords and helps to prevent food or liquid from entering the trachea. Right here you can see the area epiglottic fold, which is the lateral border of the epiglottis. Now, let's go inside and get a bird's eye view of the larynx. All of these structures that you see here are what we call the larynx. This is the front of the body, this is the back, this is the person's left, and the person's right. This potato chip looking structure is the epiglottis, which, if you remember, comes over and covers the vocal cords to prevent food or liquid from entering the trachea. And those white triangular bands you see are your vocal cords or vocal folds. The vocal cords and the space between them are called the glottis. The vocal cords are open or apart when you are breathing, which looks like this picture on the right. This would be called an open glottis. The vocal cords then come together when vibrating against each other to produce sound, as you can see here on the picture on the left. You could say that this is a closed glottis. And above the vocal cords are the false vocal cords or ventricular folds. They generally play minimal to no role in sound production, but I'm pointing them out because I will briefly reference them later. For the sake of understanding the intricacy and delicate nature of the vocal cords, let's look at the layers of the vocal cords as if they were cut in half and we were looking at them from the side. There are 5 different layers. Each is incredibly complex with vasculature running through each layer. Each layer exists for a different purpose, but they primarily function to aid healthy cord vibration and to protect against injury. This is important because healthy tissue allows for optimal pliability or flexibility of the vocal cords. And we want our vocal cords to be able to come together and vibrate without tension for healthy sound production. Ultimately, we don't want any of the structures of the larynx to be damaged because we use them to produce sound. That's part of the reason why I went through all this anatomy. To emphasize that these are important and complex structures with many pieces, that we want all to function as efficiently as possible. Now, onto our next section, weightlifting for singers and how it can affect the voice. Now, before we get into the later part of this video where I talk about the Valsalva Maneuver and the alternative breathing techniques, you might be wondering, is weightlifting necessary for singers at all? And the truth is that singers can benefit immensely from weightlifting. At a basic level, one of weightlifting's main benefits for singers is its ability to improve our general health. Weightlifting has been found to promote joint longevity, musculoskeletal health, and to prevent injury. According to a 2018 study by Sharoma and colleagues, weightlifting has been found to reduce the risk of type 2 diabetes and cardiovascular disease. Furthermore, a 2014 study by Seguin and colleagues found that weightlifting can increase reported life satisfaction and to elicit improvements in positive self-body image in some populations. I'm sure you've heard this phrase a million times, but as singers, our bodies are our instruments. And it's true, literally, we use our bodies to produce music. So it's crucial that we maintain our health and our well-being. And weightlifting is one way you can do that. Additionally, as performers, we want to look our best possible on stage. Weightlifting can help you to look and feel more confident on stage. And while ultimately our jobs as singers are to sing, it can't hurt to look good while doing it. But weightlifting has even further benefits to us as singers. A few weeks ago, I had the chance to interview Nathan Gunn, who, if you're unaware, is a legendary American baritone and professor of voice at the University of Illinois. He's also incredibly fit and has been exercising for most of his life, even alongside his career. One of the things that he pointed out is that many of the muscles we use while exercising are also used while singing. So it's possible feeling a muscle while lifting weights can give you an awareness as to whether or whether not you are properly engaging that same muscle while singing. He uses the example of throwing a ball to demonstrate this point, particularly for feeling the lower support muscles that you use to sing in the front and around the back. I'm about to play a few audio clips of our interview to help demonstrate these points.
If you do lift weights, you tend to know what muscles engage when. They all of a sudden engage to sing that high stuff. And you feel that if you throw a ball really hard. If you pitch a ball over the plate really hard, throwing a frisbee, throwing it a football, things all engage. And I think that's where some of this athleticism and even weightlifting can help.
He references specifically the lower abdominal muscles that are felt both while singing and exercising.
When you get into the sort of upper middle part of your range, incorporate some of those muscles down here that are more like what you do when you do crunches. And people who do that at a gym, when I say you're going to feel those engage a little bit more, strongly now, can go, oh, I know what muscles you're talking about. I should notice.
Athleticism requires bodily coordination, similar to how we as singers require bodily coordination to sing. He talks about how in both weightlifting and singing, there's a release and a contraction. I'd like to clarify this comment really quickly. I'm talking about how we breathe in singing. We release for a diaphragmatic breath by inhaling and then contract through our singing by allowing the lower abdominal muscles to pull inward while we produce our sound.
Sometimes lifting weights, sometimes playing sports where you get this coordination of movement that is healthy. The other thing about lifting weights that is really, I think, good is, there's always a release and a contraction. There's a letting go and then a flexing. That's really what you're doing when you're lifting weights. You're contracting, releasing, contracting, and releasing.
Nathan also notes that exercising has real benefits on the stage, improving one's ability to meet the physically demanding aspects of a role. For example, having enough strength to potentially lift an object on stage, and also having leg strength to be able to stand for long periods of time and to have all kinds of movement on stage. According to Nathan, all these things enhance one's convincingness as an actor or actress. There are many, many more potential benefits that singers can reap from weightlifting, such as using weightlifting to combat postural or muscular imbalances. However, we'll get into those types of things later in the video. How one chooses to lift weights can be broken down and classified into many different forms, including Olympic powerlifting, bodybuilding, isometric weight training, circuit training, and I could go on. The great thing about weightlifting is that it can be done safely by the majority of the population, regardless of age, body type, or gender. Here I'd like to note that if you'd rather avoid weights entirely, you could always try calisthenics, which is a system of body weight resistance exercises that can have similar benefits to weightlifting. That includes all kinds of body weight exercises, including push-ups, pull-ups, crunches, handstands, and many more. Nathan told me that calisthenics have been the most effective form of resistance-based exercise for him, and that they have the added benefit of being able to be performed anywhere, like a hotel room, for example. However, while calisthenics may produce similar results to weightlifting, calisthenics and weightlifting are ultimately two different forms of resistance-based training. For the purposes of today's video, we'll primarily be talking about weightlifting. Now, you may be thinking, okay, so all of those benefits from weightlifting sound great, but what's the point of this video then? Can weightlifting hurt my voice? To answer your question, there is some evidence to suggest that weightlifting may be harmful to the voice. A 2020 study published in the Journal of Voice by Rumbach and colleagues examined 89 healthy weightlifting athletes and found that nearly half of the participants self-reported the experience of laryngeal symptoms following heavy lifting. Ultimately, the root cause of these symptoms was not determined. However, one hypothesized culprit was a weightlifter's use of the Valsalva Maneuver breathing technique, which is one of our main focuses in this video today. If you're unfamiliar with it, the Valsalva Maneuver is a breathing technique used for various reasons. For example, in medical settings, it's recommended by physicians to reduce fast heart rate, or a condition known as supraventricular tachycardia. But it's also used very commonly when trying to make your ears pop while experiencing air pressure on a plane. You're experiencing that clogged feeling in your ears, and then you shut your nose and your mouth and you push inside, almost like you're exhaling, but you're not actually exhaling because air isn't coming out, in hopes of popping your ears. But the Valsalva Maneuver is also a common weightlifting breathing technique, particularly used when the weight is very heavy. To be more specific, the Valsalva Maneuver, also known as a hard glottal closure, is a forced, attempted exhalation against the closed glottis, which, if you remember, is the vocal cords and the space in between them. So it functions by you closing the glottis and then pushing an exhalation up against the closed glottis. The closed glottis functions as an occlusion then, by blocking any air from escaping. This is actually super useful in weightlifting because this closed exhalation is generating intra-abdominal and intrathoracic pressure beneath the glottis. This pressure ensures core and spinal stability. This stability is useful and important because it takes a weight's impact off of the vertebrae. You could call this impact redistribution. These effects of the Valsalva Maneuver can allow a weightlifter to safely lift a heavy weight. And because of the maneuver's effectiveness, it is often used intentionally by weightlifters. However, the Valsalva Maneuver can also occur unintentionally at heavy weight levels to provide that necessary intra-abdominal and intrathoracic pressure to safely lift a weight. This is otherwise known as a spontaneous Valsalva. Now, this forced air during the Valsalva Maneuver puts immense pressure on the glottis. I mean, you can imagine all the pressure of your exhalation pushing up against it. Additionally, the air below and between the vocal cords compounds, and there is a potential for air to be pushed or leaked through the closed glottis. This could cause a type of shearing effect on the vocal cords, which could lead to Valsalva Maneuver-induced trauma. I'd like to add here that there are some other potential health risks to performing the Valsalva Maneuver that are completely unrelated to the vocal cords. All of these side effects are uncommon, but the technique can cause irregular heartbeat and chest pain. It can also cause rapid increases in blood pressure and should be avoided by people with heart disease. Previously, I had understood how the Valsalva Maneuver functioned from a conceptual standpoint. However, I was curious to see what the throat would look like in real time while a person was actually performing the maneuver. Working with Jonathan Langenstein, a speech-language pathologist and assistant clinical professor at Northwestern University, and Dr. Andrew Stein, a laryngologist at the Northwestern University Voice Clinic, I was able to see just that in my own throat. I performed stationary dumbbell resistance exercises while undergoing flexible nasolaryngoscopy, which is a procedure that goes through the nose and allows one to actually examine the voice box in real time. We were able to record videos of my throat while I was lifting these weights and performing the Valsalva Maneuver. We also looked at two different breathing techniques, two alternative breathing methods to the Valsalva Maneuver, which we'll talk about a little bit later. I alternated between three different weights, a 10-pound weight, a 20-pound weight, and a 30-pound weight, to simulate multiple levels of resistance and to see how each differently affected the larynx. I'm about to show you the video of my throat while I'm lifting a 30-pound dumbbell and performing the Valsalva Maneuver. Before I do that, I'm going to orient you on the procedure, the nasolaryngoscopy. The flexible nasolaryngoscopy is a procedure voice specialists can use to manually examine someone's throat. A small telescope is maneuvered through the nose to get a clear view of the larynx. It's the most common way to examine the voice box. Let's take a look at me performing the Valsalva Maneuver at the heaviest weight level, 30 pounds. First, I'll show you a side view of me performing the rep before we zoom in and talk about the larynx. So this is me right before performing the exercise. As you can see, I'm sitting there with the 30-pound weight in my right arm. I am being scoped. You can see the scope going through my nose and then Behind me is the screen that shows the live imaging of the vocal cords. I'll admit my form isn't the greatest here. I was pretty tired from having performed many reps before this, but you can see me using the Valsalva Maneuver as an aid to help me muscle up the weight. Now let's zoom in on my larynx. As a reminder, this is the front of my body, this is the back of my body, this is my right and my left. This right here is the epiglottis, and those white strips are my vocal cords. As you can see, my glottis starts out in an open posture. My vocal cords are apart and there's plenty of space in between them, and that's because I'm breathing normally. As I engage in the lift, watch this. My glottis closes and then suddenly all of these structures squeeze together. These ball-shaped structures right here are the arytenoid cartilage. They're also coming tightly together, and you can see that my glottis is closed. I'd also like to note that, as a reminder, these are the false vocal cords, and you can see that they are also pushing together. And because my glottis is closed and there's all this tissue blockage preventing my air from coming through, I can exhale against the closed glottis and generate that necessary intra-abdominal pressure for my lift. We talked about the danger of the shearing effect with air potentially being leaked through the closed glottis and causing injury, but why else could all this squeezing be bad? Well, when the false vocal cords squeeze the vocal cords together, this causes something called vocal fold contact pressure, which is exactly what it sounds like. Pressure generated from the vocal folds coming very tightly together. It's also known as impact stress, which can be caused by repeated collision between the two vocal folds. High levels of vocal fold contact pressure can also occur from loud or very prolonged phonation. This may lead to, quote, vocal fold lesions, such as vocal fold nodules, polyps, or contact ulcers. Thus, vocal fold contact pressure from the Valsalva maneuver puts the vocal folds at risk of phonotrauma, or in other words, vocal trauma. Okay, so you may be asking, why don't singers just avoid the Valsalva maneuver entirely if it tends to induce this vocal fold contact pressure? It's true, as singers we could just stick to controlled breathing, which would be a standard inhalation and exhalation. We could also explicitly choose to perform exercises with light weights and high repetitions. And that may be what you choose to do. Using light weights is an option some may prefer, and is a great way to prioritize hypertrophy, or in other words, muscle growth. However, using heavier weights is more effective than lighter weights at increasing strength, while also promoting similar levels of hypertrophy to those that use lighter weights. A 2015 study by Schoenfeld and colleagues randomly assigned a group of 24 men experienced in resistance training into two groups: a low-load group where 25 to 35 repetitions were performed per set, and a high-load group where 8 to 12 repetitions were performed per set. They found that both high-load and low-load training induced similar levels of hypertrophy, but high-load training was superior at increasing strength. According to the study, if maximizing strength gains is of primary importance, then heavier loading should be used at the exclusion of lower load training. So really it depends on your goals. But if you're aiming to increase your strength while also promoting muscle growth, lifting heavy weights with less reps seems to be most optimal. To further emphasize this point, making strength gains in the gym will ultimately require lifting weights that inspire some degree of personal difficulty, so that you can utilize something known as progressive overload. Progressive overload is the process of incrementally increasing a weight to a lift after becoming comfortable with the previous weight. By utilizing progressive overload, you can most effectively promote strength gains and muscle growth by putting your muscles under continuous stress. All this to say, the Valsalva maneuver breathing technique is very effective at heavy weight levels. And if you do stick to controlled breathing, you miss out on maximizing progressive overload. And that's exactly where the alternative breathing techniques come in. At a very basic level, as long as you're exhaling while you're lifting a weight, the vocal cords will not be in contact. So there are many possible alternatives to the Valsalva maneuver breathing technique. However, today I will be introducing you to two of them. Both of these breathing techniques make weightlifting more compatible with singers by not creating pressure at the level of the glottis. These breathing techniques are the pursed lip method and the hissing method. Both of these function by creating a pressure valve somewhere other than the vocal cords and ensure that the vocal cords are not touching. Let's talk about our first technique, the pursed lip method. The pursed lip method entails inhaling normally and then while exhaling, rounding your lips and pursing them together and allowing a small amount of air to pass through. You should exhale while lifting a weight or during the concentric phase of a movement. And you should inhale during the eccentric phase, which is the period when you are typically lowering the weight down. So it goes like this, and imagine for the sake of this demonstration that I'm bench pressing right now. So during the concentric phase of the lift, or when you're actually lifting the weight, you purse your lips tightly together and then you push the weight up. And then once you're at the top of the lift, you enter the eccentric phase when you're lowering the weight. And here you want to inhale. Now, there's a reason why this breathing technique is better than a standard inhalation and exhalation. According to Jonathan Langenstein, because there is a point of resistance being created at the lips, the air that does not escape from the mouth is being pushed back into the throat. This column of air being pushed back dilates all the structures of the throat, keeping the vocal cords wide open, but it also generates necessary internal pressure for a lift. So this technique functions similar to the Valsalva Maneuver by creating internal pressure and support, but this pressure is not being generated by exhaling against the closed glottis, but rather exhaling against the pursed lips. So we've shifted the occlusion area from the glottis to the lips. Allowing some air to leave ensures that there is a consistent exhalation and that the vocal cords are not generating contact pressure. Now, let's look at a video of me performing the breathing technique while lifting the same 30-pound weight. Now, let's look at the larynx. As you can see, the exhalation from this method creates plenty of space between the vocal cords, ensuring they are not touching. The complete opposite of the Valsalva Maneuver. A cool modification to this breathing technique is that you can vary the amount of pressure that you generate with how tightly you purse your lips. For example, pursing your lips extremely tightly together like this will generate more pressure than if you were to leave your lips more relaxed and open but still a little bit pursed like this. This is because more air is then escaping from the lips and not being pushed back into the throat. And then there's our second Valsalva alternate breathing technique, which is the hissing method. It's pretty similar to the pursed lip method. You exhale on a hiss while performing the concentric phase of an exercise, and then inhale normally while doing the eccentric phase. By placing the tongue at the front of the teeth and exhaling through a small mouth position, one can maintain an open glottis while generating resistance pressure. Now, instead of the occlusion being created at the glottis or the lips, in the case of the pursed lip method, the point of occlusion is being created by the tongue at the front teeth. Let's take a look at me doing the hissing method while lifting 30 pounds. And now let's take a look at the larynx. As you can see, there's plenty of space in between the vocal cords. Perhaps a little bit less space than the pursed lip method, but they're apart nonetheless. Summarized, both of these breathing techniques are vocally safe alternatives to the Valsalva Maneuver that may elicit similar levels of internal resistance pressure. So next time you're lifting weights, I encourage you to try these breathing techniques out and see how you feel. See if they are effective for your exercises and also if you feel vocally healthy after performing them. But ultimately, this area has not been extensively studied, so do so at your own risk. And hopefully there will be further future research in this area. Now I'd like to share some general tips and information for singers who may be interested in weightlifting from my research and also from interviews and people that I talked with along the way. So let's get into our first section, weightlifting to fix posture and muscular imbalances. I read a blog not too long ago that said that singers should completely avoid weightlifting because it can cause you to have rounded shoulders. And those rounded shoulders would then collapse the sternum and cause you to have raspy breath support. It is true that rounded shoulders can adversely impact your singing. A few weeks ago, I spoke with Teresa Brancaccio, a senior lecturer and vocal health expert at Northwestern University's Beanin School of Music. According to Professor Brancaccio, rounded shoulders can depress the sternum and prevent an ideal open singing posture. However, rounded shoulders aren't at all a necessary consequence of weightlifting. This issue is more likely to be caused by something like daily slouching, or maybe by an unbalanced lifting routine. Perhaps one that overemphasizes pushing exercises like the bench press and neglects pulling exercises like the barbell row. Pushing exercises generally strengthen the anterior muscles or the front of your body, and pulling exercises often strengthen the posterior muscles of your back. Doing only pushing exercises could lead to rounded shoulders. So pushing and pulling exercises should ideally be balanced in a lifting routine. And that leads me to my point. There are existing exercises that can counterbalance the physical imbalances that may be interfering with your singing. In her book, Complete Vocal Fitness, Claudia Friedlander introduces corrective exercises, which are exercises that focus on, quote, resolving imbalances in order to improve overall function. Friedlander references the National Academy of Sports Medicine's corrective exercise continuum as a means of correcting these imbalances. The continuum is a 4-step process that begins with 3 warm-up phases, which includes the first stage of inhibiting overactive muscles through techniques like foam rolling or a soft tissue massage, the second stage, stretching, and then the third phase, doing some light muscle activation exercises. The final, 4th phase is performing the corrective exercise itself. If this framework sounds appealing to you, I recommend reading more on the National Academy of Sports Medicine's website. Now, to clarify the utility of a corrective exercise, let's walk through how a movement like the face pull, for example, could serve as one. So you're aware of what the exercise looks like. Here's a video of someone performing it. So let's say you have poor posture, you're sitting down for a majority of the day, and you slouch. The face pull targets the posterior deltoids, or the back of your shoulders, as well as the upper back muscles, such as the trapezius. The face pull strengthens these muscles, which in turn pulls the shoulders back and encourages an upright posture. So by doing face pulls, you can directly improve your posture, and the implications of this are huge for singers, because having good postural alignment is incredibly important. Friedlander points out, quote, good alignment is essential for vocal development and performance. The spine provides the foundation from which all movement originates, and a well-aligned spine facilitates free laryngeal movement, full resonance, and expansive coordinated breathing. So the main idea here is that face pulls could directly improve your posture, which thus potentially could significantly improve your singing. And this was just an example of one exercise. There are many, many more other corrective exercises out there to address all kinds of posture and muscular imbalances. Friedlander goes much deeper into this in her book, providing ways to assess postural alignment, along with providing exercise routines for singers, stretches, warm-ups, as well as a ton of other information regarding how our physiology relates to our singing. I highly recommend you check out Complete Vocal Fitness for more on exercising and the voice. Now, on to our next section, procedures for safe weightlifting. It's important that you're able to weightlift safely and sustainably without taking any unnecessary risks. I spoke with Dr. Jeff Mianis, Northwestern University's Director of Intercollegiate and Health Service Sports Medicine and head team physician, about weightlifting-based injuries and prevention among athletes. According to Dr. Mianis, athletes' most common weightlifting injuries include mild muscle sprains, with lower back sprains being the most frequently seen. Although uncommon, lumbar spine injuries can also occur, including injuries like disc herniations. There are several practices that can lower the risk of weightlifting-based injuries. The first of which is prioritizing proper form. Part of this entails focusing on something Dr. Mianis calls the order of muscle recruitment. Essentially, when you are performing an exercise, you should consciously focus on the progression in which you engage each muscle to ensure you are using proper form. Let me explain why the order of muscle engagement is important. How you may instinctively lift a weight is likely not the safest or most optimal way of performing that exercise. For example, if I were to go do a barbell row and had no knowledge about the muscles that were supposed to be engaged, my instinct would be to simply bend over and pull the barbell, probably relying very heavily on my lower back. I would not be focused on maintaining a flat back, pulling with the elbows, or intentionally engaging the lat muscles. But these are all things that are necessary for performing the exercise correctly. By consciously focusing on the progression of muscle recruitment, you can ensure that you are engaging the proper muscles and that you can perform the exercise correctly. I referenced progressive overload earlier in the video, but it's important to note that over time you should increase the amount of weight used slowly, rather than drastically increasing the amount of weight used. This is because rapid progressive overload could potentially heighten the chances of injury. Hydration and proper nutrition are also vital, not only to stay alive, but also to prevent training-based injuries. In regards to nutrition, depending on your goals, you may be at a caloric deficit, caloric surplus, or even a period of maintenance. A caloric deficit is when you eat fewer calories than you are using per day. This aids in weight loss. A caloric surplus is when you eat more calories than you use per day. This aids in weight gain. And maintenance is eating just the amount of calories you need to maintain your weight. Regardless, you should make sure you are receiving enough protein, especially if lifting weights, for proper recovery and also muscle synthesis. The optimal daily protein intake for someone trying to gain muscle is between 0.73 and 1.5 grams per pound. But of course, this optimal number will vary based on your age, sex, current weight, and your goals. Sleep is also crucial for recovery and preventing injury in weightlifting. Moreover, sleep is necessary to promote healthy voice function and coordination among singers. Results from a study by Ferreira and colleagues found that sleep is linked to vocal production, and that, quote, similarly to hoarseness, vocal fatigue was associated with few hours of sleep. It is also essential to work on your mobility alongside your strength training. According to Dr. Mianis, balancing mobility work with strength training is critical among athletes. Doing mobility work promotes flexibility and a full range of motion in your body. As singers, we must maintain our ability to move our bodies comfortably and freely. Stretching, for example, is necessary to ensure that our joints are healthy. Stretching has also been found to prevent injuries and to induce increases in muscular performance. Pivoting a little bit, I should mention that there are some common weightlifting exercises that should be minimized or completely avoided due to their biomechanical risk. Upright rows, for example, are an exercise where you hold a weight by your waist area and lift it up to your collarbone with your arms, eventually pulling above your shoulders. It is intended to build strength in the shoulders and upper back. The way that you lift the weight while doing an upright row causes the shoulders to rotate internally. However, your shoulders normally rotate externally when brought above the shoulders. Thus, this exercise is not functional and can cause or worsen shoulder impingement. Another harmful but commonly performed exercise is the behind-the-neck lat pull-down. The conventional lat pull-down is a machine-based seated exercise in which you grab a bar with your hands about shoulder width apart and pull the bar down to your upper chest. This exercise is very effective at strengthening the back muscles. The problem lies with a common variation of doing the lat pull-down behind the neck. It requires you to keep your head in a shifted forward position, which may cause neck discomfort and adversely affect posture. Furthermore, the behind-the-neck lat pull-down can cause stress to the shoulder capsule and rotator cuffs. According to Dr. Mianis, this exercise is generally avoided across the board in athletic departments at Northwestern. And these were just a few examples of exercises that could put your body at a biomechanical risk. When you are evaluating a workout routine, it's crucial that you research the recommended exercises and their intended functions. In classical singing, it's generally taught that having active control of the abdomen is essential for support. The simplified mechanism is to allow the abdomen to expand for a breath, and then while singing, to move the abdomen inward. This inward momentum is thought to, quote, elevate the rib cage and thus promote efficient generation of subglottal pressure during phonation. A 2016 study conducted by Salamoni and colleagues at the University of Queensland found that classically trained singers tend to actually put this into practice and do utilize the abdomen more than untrained singers, quote, demonstrating greater contribution of the abdomen to total lung volume than untrained individuals during singing tasks. And this was associated with prephonatory inward movements of the abdominal wall and a greater degree of independence in the movements of the rib cage and abdomen. Maintaining freedom of the abdomen is certainly something we should consider when crafting our exercise goals. According to Teresa Brancaccio, overtraining the abdominal muscles or allowing them to get too tight can restrict the way that the body releases for this lower abdominal inhalation. This inability to fully expand would in turn limit one's support and potentially inspire suboptimal voice quality. One potential way to prevent high levels of abdominal growth would be to prioritize compound lifts and to avoid abdominal isolation exercises. Compound lifts are staple exercises that work multiple muscle groups. The 5 basic compound exercises include the bench press, squat, deadlift, overhead press, and pull-up. And compound exercises do not seem to have a significant impact on core activation. A 2009 study by Willardson and colleagues performed EMG assessments on levels of external oblique maximum voluntary contractions in the back squat, deadlift, and overhead press. When test subjects performed exercises at 50% and 75% of their 1-rep maxes. An EMG or electromyogram assessment works by sending signals to measure muscle activation. This muscle activation is usually measured in a percentage of maximum voluntary contractions. At 75% of the subject's 1-rep max, both the back squat and deadlift had about a 5% level of external oblique activation, and the overhead press had about 10% activation. These are all relatively low levels of activation. Abdominal isolation exercises, however, are much more effective at getting that core activation. A 2014 study published in the Journal of Strength and Conditioning Research found that external oblique activation was about 35% for front planks and 40% for side planks, 2 exercises that are very much intended to isolate the abdominal muscles. Back squats, on the other hand, elicited less than 20% activation. This is more activation than the 5% from the previous study. However, this is most likely because of the difference of procedures used in these studies. In this study, subjects performed 90% of their 3-rep max, in contrast to last study's utilization of 75% of the subject's 1-rep max. Comparing normalized EMG averages across studies is unreliable because how activation was assessed will vary by the procedures of the study. The important idea to note from this study is that the isolated abdominal exercises were more effective at activating the abdominal muscles compared to the back squat, which was the compound exercise examined in this study. The abdominal isolation exercises had nearly twice the amount of activation. Thus, if you strictly do compound movements and avoid direct abdominal training, you will get some level of abdominal activation, but not a very high amount, which might be exactly what we want as singers. I should note, however, that there is some evidence to suggest that Olympic powerlifting, which is a form of weightlifting that is just entirely compound movements, has been found to induce abdominal thickness. A 2011 study by Stillert-Pisson and colleagues looked at 16 female Thai national weightlifters and 16 matched controls and found that lateral abdominal muscle thickness was significantly greater in the group of professional weightlifters compared to the control group. Because isolated abdominal exercises are not considered Olympic powerlifting lifts, the results of this study could be a limitation to my previous claim about simply avoiding direct abdominal work and just doing these compound lifts to limit abdominal development. However, Olympic powerlifting lifts generally require much more movement than the basic 5 compound lifts we talked about earlier. It's also possible that the 16 Thai weightlifters did some form of direct abdominal training outside of the Olympic lifts. Furthermore, the subjects were elite athletes, lifting much more intensely and likely much more frequently than the average weightlifter. Thus, perhaps this stark difference in abdominal thickness is just an extreme example. I'd now like to talk about yoga as a means of strengthening the abdominal muscles because it poses a very interesting question for singers. A study by Cuneo et al. Conducted EMG assessments to compare external oblique activation levels while subjects performed abdominal crunches and a seated yoga breathing exercise. Results showed that there was more than 50% more external oblique activation in the yoga exercise than the abdominal crunches. This would suggest that yoga can activate the abdominal muscles even more than the direct isolated abdominal exercises. Of course, only one yoga exercise was assessed in the study, and it was being performed for a longer time period than the crunches. However, the significant core activation in the yoga exercises is something we should definitely pay attention to, because along with evidence of strengthening muscles, yoga has been found to prevent muscle tightness. If yoga can strengthen the abdominal muscles and simultaneously stretch them, yoga may be the most optimal form of core exercise for singers, and perhaps even more effective than direct abdominal training. Pilates is a mind-body exercise system that is very similar to yoga and also prioritizes core strength. And some singers have espoused that Pilates has been incredibly beneficial to their singing, including renowned soprano Renee Fleming, who said, "I discovered the wonders of Pilates. The best part of it is the intense focus on core strength, which we singers need almost as much as dancers." But not all singers shared the same enthusiasm for Pilates, including Nathan Gunn, who claimed that Pilates was too tiring for the core and adversely affected his singing the next day. All this to say, perhaps as singers there is some benefit to doing isolated core exercises or yoga or Pilates. But like all things fitness related, it will vary from person to person. When trying out one of these movements, a good question to ask is, how does my abdominal expansion feel the day after exercising? And then 2 days after? And then a week after? If you notice the exercise is drastically hindering your ability to support, it might be something to avoid. While weightlifting, you don't want to engage muscles that are not intended to be engaged during a given exercise. That's because unnecessary tension generally isn't good for us as singers. A common tendency among weightlifters is to allow their faces to contort and tense up while lifting a weight. Similarly, jaw clenching is common among weightlifters. However, that's not to say that it's entirely useless. A 2003 study found some evidence to suggest that this jaw clenching is effective in increasing grip strength and force production. However, as singers, we want to avoid this jaw clenching to ensure that our jaws are free of tension and relaxed while singing. Another common area of tension among weightlifters is in the neck. When you're squeezing out that last rep, you may feel your neck start to grab and tense up. According to Nathan Gunn, a general rule that you could abide by as a singer is to not lift past the point when you start to feel your neck engage.
There's going to be a point where you're going to start to feel these muscles engage because you want to finish, and once you feel that, stop. It's good to know what your body is doing, and it's good to know that, oh, I'm not using my neck muscles to do this. I'm actually using the muscles that are appropriate.
Ideally, everything from the neck up should be relatively free while weightlifting. Relating to that last point, I think as singers we should be looking at exercising differently than the average person who's working out in the gym. And that's because we deeply care for our voices. This is another idea that I got from Nathan Gunn. But as singers, we should alternate the way that we exercise based on what's going on in our lives. For example, if you're amidst an intense week of singing, you could try lifting lighter weights if you want to avoid the high physical impact of lifting heavy weights. You could also use that time to prioritize your cardiovascular fitness. Go on a bike ride or go on a run. We have the ability to reprioritize and adjust our fitness activity based on our circumstances. And that is such a great thing for us as singers. We should be looking at exercising unconventionally because the body that we use to exercise is the same one that we use to sing. We have this extra layer of importance in maintaining our bodies compared to most people. And it is true that in protecting our ability to sing, we may not be able to achieve the most optimal performance in the gym. As in the case of not allowing our necks to tense up, jaw clenching for maximizing grip strength, or even performing a full Valsalva maneuver for maximizing intra-abdominal and intrathoracic pressure while performing a 1-rep max. But that's okay because we prioritize protecting our ability to sing. There's a lot we can gain from weightlifting for our well-being, physical health, and for our voices. And everyone has a different fitness journey, so it's important that we think about it that way. Overall, I made this video because there's a lack of information and research regarding the intersection of vocal health and weightlifting, as well as other forms of exercise. There is plenty of advice out there, but much of it is unsubstantiated and gives a false reality about how weightlifting could affect the voice. I hope this video has helped you to see that we as singers are not barred or restricted from bettering our physical health, and that there are ways to think about conventional exercise practices differently. And in thinking this way, we are given a better awareness of our body and the mechanisms that we use to sing. This awareness only aids in our ability to effectively use our bodies to produce music. Anyways, that's all I have today. Feel free to reach out to me or leave a comment with any questions, criticisms, or general thoughts. Thank you so much. I wish you the best on your fitness journey and all of your singing endeavors. Bye-bye.